Hi, Paul Auwaerter here, Site Advisor for Medscape Infectious Diseases, and speaking today from Johns Hopkins. The topic that I thought I'd blog about today is the situation with influenza. As many of you know, in 2005 and 2006, a significant number of strains from that season were resistant to drugs such as amantadine and rimantadine, which had been for many years the stalwarts of influenza treatment. At that point, recommendations changed to solely consider oseltamivir or zanamivir for chemoprophylaxis or treatment of influenza. Drugs have been used for many years, and perhaps not a surprise to any that resistance developed, but luckily we had the new neuraminidase inhibitors in hand. Although this has been a very light influenza season to date, certainly knock on wood, a complete surprise has been a new strain of influenza A, that is H1N1. This virus, so far, the isolates obtained in the United States, 98% of strains have been resistant to oseltamivir. This appears to have been first described in Scandinavia and in Norway, a country which really uses very little oseltamivir, and countries such as Japan using significant amounts of oseltamivir. No resistance has been described. This is obviously a very unusual situation and has prompted the Centers for Disease Control and many, such as here at Johns Hopkins, to change recommendations. And so please take note of these changes for any patients that you may need to empirically consider treating for influenza. So based on the fact that we have an H1N1 strain that's resistant to oseltamivir and H3N2 that is still susceptible in many cases to amantadine or rimantadine, the current recommendations are to use both drugs, both oseltamivir and either amantadine or rimantadine. Zanamivir remains a option. Of course, this is an inhaled powder, so for many who might have significant airway disease, chronic obstructive lung disease, and so on, this is not a therapeutic option. The influenza season has been light, but remains interesting. Many are trying to figure out how this strain of H1N1 actually evolved and why it exists in the face of very little oseltamivir use. So the take-home points, of course, are to use both oseltamivir and amantadine or rimantadine for your empiric treatment of influenza. Unfortunately, rapid diagnostic tests do not distinguish between these two types. So for all intents and purposes, treatment while your patient is still ill is likely going to have to be both drugs. Thanks for listening.